cloud. Okay, so here is coursework page, obviously for this class here. And so we have today 2 things due. We got the chapter 5 quiz due, which we went over last week. And then this assignment, which I'm not sure where everyone is at with that. If you need more time on that, you have to let me know. And also if you need some help with observing, this was to observe either a class or 2 or 3 infants or up to toddlers for about 30 minutes, and then look at some of their specific behaviors and states and answer these following questions, okay? And then just write it up into like what you observed and in answering these questions, okay? So like I said, if you don't have access to 2 or 3 babies or toddlers, we do have the Immersion Nest Campus Kids up here that I can get you into to observe in the infant and toddler room for about 30 minutes. So you have to let me know if you need some help with that, or if you need extra time on that, because that's also due today at midnight. Okay, so a couple things there to work on if you haven't done that yet. One thing also that I don't know if we missed it or I didn't do a very good job of explaining, but there was a discussion post for chapter 3. And so maybe as I go back and read it, maybe it was not quite clear on what to do, but this discussion post talks about like Piaget and his developmental levels, right? And so here it talks about that in some cultures, students are able to conserve prior to the ages that were originally described by Piaget, basically meaning that they do things earlier than what Piaget says in his stages, right? So like, whatever it might be, walking or sooner, grasping things sooner, ability to do something, sooner than what he says in his stages. So what I was wanting you to think about was think of some skills, some activities, whatever it was, if you can, that you or maybe members of your family needed to survive. Now, don't think of survive as like fighting for life and death type thing, but things that you had to do when you were younger that were skills that you developed. Okay, and so is this different than did you learn to walk earlier or later than, or crawl earlier and later than maybe what Piaget's stages say? So because things can differ from culture to culture. An example that they have in the book talks about in Kenya, for example, as children are often raised outside in some like tribal villages that they were talking about in the book. And so there are a lot more dangers out there in terms of like hot fires from cooking pits, certain animals that are obviously wandering about, cliffs, just all kinds of dangers there. And so that they actually carry their children until they understand what those dangers are. And going to need help with what those dangers are, and so they carry them until much older, as compared to like what we probably do in our area here. Okay, and so how does that affect things? Traditional Navajo families carry children in their cradle boards and on their back, or in their hands for a certain period of time. How does that affect a variety of things? So if you can think of some things that you did as a child, as an infant or toddler, maybe you don't remember, but maybe you could ask somebody about that, or maybe certain things you did with your own kids if you have kids, that might be a little bit different than other people that you know. Okay, so if you can think of some things, if not, then put that in here as well. I don't remember them, we didn't do anything different, whatever it might be. So there's no really right or wrong answer for this discussion. So when you go back and do that, then I will give you credit for that in the coursework page for that. Okay. The other thing you probably maybe noticed or didn't notice in here is that after chapter 6, there are not any more quizzes on there. So I'm still working on adding questions to the remainder of the quizzes for for this chapter or for this book and this class. Okay, so remember, you can use your book, you can use the PowerPoints for any of the quizzes. Okay. Coming up in a couple weeks, and so just another heads up on that, is an interview with a childcare provider. And so again, this can be expanded a little bit as well if you want to talk about, you know, not just childcare provider, but it could be somebody doing an in-home daycare, or it could be somebody caring for their own children or child at home. But I'm really looking for, because we're talking about infants and toddlers over these next few weeks, you know, since last week and moving forward in the next couple weeks, but talking with them about some of these areas. So I have you can ask kind of any questions you want, and you could actually modify these statements here and use them as questions, but you can kind of come up with the questions that you want to ask or address them. Okay, so for example, most challenging dimensions of providing infant childcare. Okay, so you could ask, what is the most challenging piece of providing childcare for infants? Okay, what's the most satisfying? You know, those types of things. Okay, so you can, even though I ask you to come up with your own questions around these topics, you could use these as questions if you're not sure. Okay. So after you interview the childcare provider or the teacher, then kind of synthesize the information into answering these components here or these questions here. Okay. Again, if you can't find anybody or need help, we can definitely get some of our teachers and providers here at the Nest and Campus Kids to help you and sit down for an interview if you prefer to do it that way. So please reach out to me if you have questions. This is still 2 weeks away, but I just want to put it on your radar as we move forward, that you'll have to be thinking about asking somebody or finding somebody. And if you can't think of anybody, we've got some people here that would be more than willing to help you with that. Should take 10, 15 minutes. It could be a phone call if you want. It could be a Zoom session. I can set that up and help navigate that based upon around your schedule and around their schedule, when they have breaks and when they have time off or on, that type of thing. Okay, so if you got questions on that, please reach out and let me know as well. Okay, so today, bumping into chapter 6, let me get on the right spot here. So we're talking about physical growth of infants and toddlers today, okay? And so we'll break it up into a couple different parts here, but if you got questions as we're going, interrupt me or type in the chat box or whatever it might be, but let me know if you got questions and we'll go through that. So first thing we talk about is physical growth for infants and toddlers. So physical growth is very rapid in infancy and infancy and toddlerhood. Children acquire many new motor abilities and self-care skills during this developmental period. They also acquire new perceptual abilities. They can see, hear, touch, taste, smell, as well as adults can by 6 months old. Okay, so that develops very, very quickly. Physical growth and perceptual and motor development process progress in a relatively fixed order. For example, babies swipe at objects before they can grasp them. They hold objects between their fingers and palms before they can use their pincer grasp. Toddlers can view objects clearly, but only later will move their eyes and heads to scan objects fully or to solve problems. Okay, so like we said, very fast or rapid growth. Okay, examples here: baby fat, muscle, bone, tissue. So obviously when a child is born, right, there's not a whole lot of fat on them, but then as they start to grow and develop, typically kids get a little bit more chunkier. Okay, they got some of that baby fat on there to help protect their body, to start growing and developing. And so until they really start moving a lot, then sometimes that starts to disappear, sometimes it doesn't. So muscle is growing and developing, bone and tissue are growing and developing, the brain is developing. So there's all kinds of rapid growth in the first years for a child. Okay, there is a large amount of variation across individuals and cultures. Okay? And so we see all these milestones that we'll talk about here in a minute that children typically hit. Okay? And so a lot of times there's a date associated with that or an age range associated with that. walking by, I don't know, 12 months, 15 months, or 12 to 15 months. Some are earlier, some are later. It doesn't necessarily matter unless it gets very, very largely delayed. But individuals differ and cultures differ depending upon where kids are raised across the world, where they're raised across different parts of the state or countries. Also, certain families have certain ways that they do things. Okay? And so, looking through the book, reading through the book, it talks about a lot of variations, differences amongst cultures and how kids grow physically and also cognitively as well. Okay. So these are some of the predictable milestones that we typically see. So there's great individual variation in the age at which perceptual and motor abilities are acquired. Culture may be one factor that influences the pace of motor development. For example, the games that parents play with their babies and toddlers, how they carry their infants and toddlers, kind of like I talked about earlier with the group of people in Kenya. The kinds of toys available can affect physical competencies, and how quickly toddlers learn self-help skills such as toileting can be influenced by cultural beliefs and practices. Okay, so these are pretty standard patterns of development. Okay, when you raise their head, chest, sit up, sit alone, steadily, stand with support, creeps, walks. It's just a progression of milestones that children typically follow. Okay, and then, like I had mentioned before, cultural practices definitely affect the development of some of these milestones. Okay, I talked about cradle boards, and it's not just Navajo families that use cradle boards. A variety of people use cradle boards. And so there's also direct training, like specifically how teaching a child how to do something specifically, rather than maybe then letting them explore and learn it on their own. So there's so many different variations. We have to be careful when we see research theories, stages that talk about, oh, this should be done by X number of ages. And as the interesting thing I like about this book is that when we're talking about like theories or ideas or stages, that a lot of time from a multicultural perspective, it provides a different point of view and gives us something to think about in terms of, well, is this right, or can this be adapted to fit a different situation or a different group of people? So that's the one thing I do really like about this book. So more motor abilities, grasping, okay, again, some milestones, okay, so swiping at objects, okay, without contact in terms of infants and toddlers, swipes and makes contact, grasping movements, squeezing, holding between fingers and palm, fingers and thumb, and then the pincer grasp, of course, is picking up objects with the thumb and the index finger. And so development occurs again from the inside out, right? And so babies, infants have more control over the center of their body than their arms and their legs. That's why the pincer grasp is one of the last things to develop, because that's more difficult for them to master and to be able to control. But this is easier to control. Okay. So now as toddlers, motor abilities continue to grow and develop as well. So you have coordination, then more of the fingers and thumbs, which is when, again, that pincer grasp comes into play, and then a little bit more coordination with walking and running, helping parents maybe helping a little bit, family members helping a little bit, and also doing and encouraging some of that running components as well. And so we're going to watch this video. Okay, so as you, let me know, Lori, if you can hear this or not, but as you watch this video, pay attention. Maybe. There it is. Okay, so pay attention to their fine motor skills, right, and their gross motor skills. Remember, the fine motor skills are more of the very detailed components, like grabbing, pincer grip, those types of things. And then the gross motor skills are more of the walking, the moving of the arms, those components. Okay, so I'm going to watch a couple minutes of this here. And then I just want you to tell me where you think the child is at approximately for, I don't know, milestones, okay, and how they are using their fine and gross motor skills. Let me know if you can't hear it, not that it matters.
Who's this guy?
I can hear it fine.
Okay. There we go.
I'm taking him. I'm taking your elephant. I'm taking him. Oh. Where'd he go? Where did he go? Where did he go? The elephant. Where is he? You got him. Thank you. Thank you. All right. Where is he? There he is. Yay! Yay! Wow! Wow! What is that? What is that? Wow! Neat! That is so neat! What do we do with this thing? Look at those crazy beans! Oh. Is that where it goes? Yeah. Close it up. Open. Yeah. There you go. Closed. Open. Oh. Yeah. What's in there? Yeah. What?
All right, any thoughts on that? What do you think about the fine and gross motor skills of that young child there?
I think he's more of in his perceptual stage, and he's getting to know the object more.
Right, you can definitely see that he's, using his, he doesn't have to use both hands to grab it. He's able to grab things with, sometimes, using the pincer grip or all of his hand and fingers there. He's walking, moving, his gross motor skills are pretty good. So typically, so if you're observing a child, for example, or when we're talking about, that observation of the infants, toddlers, and looking for certain things, what they're doing, then you can kind of see what to look for almost, right? In terms of like watching their fine motor skills, their gross motor skills, and those components there. So I don't know, pretty general, I guess, not a real exciting video, but just kind of showing how simple maybe it is to kind of, get children to work on some of those fine motor skills, those gross motor skills in terms of movement and interacting with them. So. Okay, one of the other things in terms of perceptual motor abilities, so self-care, right? So eating, right? What is the way that families encourage eating? What are the rules? What are the expectations? What are the tools? Think across the world what that might look like. Whether you use silverware, not use silverware, just use their hands, whatever it might be. So self-care, eating self-care skills, again, varies from culture to culture and continent to continent. You know, some families feed their obviously their infants, but even up to sometimes toddlers, they will feed them because they don't want maybe messes and those types of things to clean up. So it just depends. Same with toileting, right? Most children have active bladder and bowel control by age 3, so that is a possibility. Again, not every child does. So those that do not have that control, it shouldn't necessarily matter that it takes them longer to be toilet trained. So again, these are based on child parents' expectations, cultural expectations of children in terms of that self-care for toileting. Also, newfound independence requires childproofing an environment. So, you know, whether they're getting into certain things around the house, outside, at school, that could be a danger to them. What does that childproofing look like? You know, is it locks on doors so they can't open them and get in there? Is it putting that material or those things that you don't want them in up higher so they can't reach them, rather than leaving them lower so that they can? It just kind of depends upon that culture of that home environment. Okay? In terms of a cognitive approach for that, which, you know, cognitive approach means based upon like brain development and thinking, right? Helping toddlers understand the purpose and consequences of caring for themselves in daily life is an important way to go about doing that, right? So explain the importance of self-care. Why is it important that they go, you know, to the bathroom on their own, that they wash their hands on their own, that they are able to eat by themselves, you know, all those components. What's the importance of that? I think that's a good practice for anything that we're trying to teach children, toddlers, all the way up through adults, is that we're explaining why we're doing that, right? Pointing out the consequences of an accident. Okay. Also, what happens if you're working on toileting and toilet training, and they, you know, go to the bathroom in their pants? What's the consequence of that? Now you got to change. Now you got to clean up, take a bath, you know, whatever it might be. So, not that it's always that we you know, get after them or holler at them or punish them, but when there's an accident, there's something that has to be taken care of on the other side of that. Okay? Asking simple questions about an event if something goes wrong, or when they're doing something, asking simple questions, redirecting behavior towards the self-care task. So if they get off task, you know, washing their hands, for example, by themselves, especially as children get into preschool and kindergarten, in terms of constantly washing their hands. They get off task on that, redirecting them towards that, and giving the children different choices to make in terms of whether they want to do it or not do it. If they don't do it, then this is the result of it, or the consequence, or whatever that might be. So giving kids choices is a good opportunity to give them some power, some decision making. Okay. So vision, then, this is another perceptual development component. Vision is obviously very important, but newborns can see between 7 and 15 inches away from themselves. Okay, so in the book it talks about they can see different patterns, right? But the one that they prefer the most are human faces. Okay, and so that is probably one that they see the most as they're being probably held quite a bit in terms of those newborns. But within the first 6 months, children can distinguish colors. They can start tracking and moving objects more smoothly rather than herky-jerky. And then they can scan the features of the object. So it's more than that they just see the object, but that they can start to look a little bit more at the details. Okay, and then by the time they are about 1 year old, that they have more of their adult or our adult-like vision. Okay, development of depth perception, a little bit more understanding of those components. So again, vision develops fairly quickly in our infants and toddlers. Okay? Hearing is another perceptual development. Okay, so studies do show that hearing does develop before children are born, and high and low pitches, loud and soft noises, approval and disapproval, newborns are able to distinguish between them. Okay, so they prefer the mother's or a female singing voice, okay, over a male singing voice, and they also have adult to child speech is something that is important. I know a lot of times we want People talk to infants in like kind of babble or very like infant language, but it's also good to talk to children in adult language so that they start to understand, hear, and learn to develop speech patterns, language, and so that's very, very important as well. Okay. Taste and smell. So again, this research shows that taste and smell is likely acquired before the child is born. They're not 100% sure, but it is likely that that does happen. So newborns right away, they can tell the difference between sour, bitter, salty, sweet, and neutral tastes. And typically newborns do prefer sweet and salty, okay, over the sour and bitter, which I don't know who prefers sour and bitter over salty and sweet. So that kind of makes sense to me that might be all of us prefer that. Also, pleasant and unpleasant smells, they can tell the difference between them, even like the smell of other people, right? And so typically children and infants prefer the smell of their own mother as opposed to other people that they might be in contact with. Okay? Again, probably because they are, spend 9 months, 10 months with their mother before they are born. Okay. Touch then is another one, again, develops before birth. So parental touching, okay, elicits smiles, gazes, attention, and often connected with other senses, right? So touch is a very large way that infants figure out their surroundings, okay? So touch and also taste. Children do and infants do a lot of that, as you can probably see with infants. They take a lot of things, put them in their mouth because they're trying to figure some of those things out, what it is, what it tastes like. Obviously, infants do feel pain. That's not anything that's probably earth-shattering to anybody. But as we move into toddler development, many adult-like abilities are developed by 18 months, but some of these things fall into line here with that. So the abilities are not always focused, they're not always coordinated, they still need to continue to grow and develop those. Okay? Line of sight is low, obviously, right? Toddlers are very short, which is why in our classrooms, if we're working with toddlers, even younger children, we want to put things down at their level that we want them to work with and be engaged in, okay, rather than keeping them up on the shelves, because that also allows children to work on those or play with those objects and do activities on their own rather than always asking for help. Okay? Still working on interpreting sounds, right? Using touch to solve problems and influenced by taste and texture, as I kind of mentioned a little bit earlier. Okay? The book also talks a little bit about brain growth, brain cells, brain development. The brain grows and develops at a remarkable rate in infancy and toddlerhood. So a typical 3-year-old has twice the number of synapses or connections among brain cells as adults. After age 3, children start losing synapses they do not use. So stimulation and warm, responsive caregiving are needed to ensure that important brain cell connections are created and maintained. So there's an old saying, or I don't know if it's old, but use it or lose it type thing. So that kind of is true with our brain cells. The parts of the brain or the cells in the brain that we do not use, that are inactive, typically basically die off. And so with our young children, we want to keep them as active and engaged in a variety of things as possible to keep those synapses firing and using. So this talks a little bit about how the brain works, right? Dendrites receive messages from other cells and pass them on to different parts of the body, telling our body what to do. Axons send messages from the cell body to other cells. Neurotransmitters are released in synapses. Axons are insulated with myelin. It's kind of not like super important to know about all those components, but it is important to know a little bit about where different parts of the brain, how they function, and what we use them for. So, of course, parts of the brain provide specific functions for us, right? As humans. So we have sensory regions, motor, association, frontal cortex. So if some of these parts of the brain are damaged, for example, or not working properly, then we're going to struggle in some of those different areas. So the brain can be retrained in different ways, and in some instances, not all instances, but it can be retrained if we have damage to it or an injury, for example. So by age 2, the number of synapses has reached an adult level. By age 3, 1,000 trillion synapses, again, which I said is twice as much as adult, but then after that, we start pruning them off, okay, use it or lose it type thing. So because there are so many synapses in our brain at this age, it allows for that rapid learning of a variety of things, as long as we are exposed to multiple things, okay? And so if we don't have that connection, okay, that adult connection, that caring, and also the stimulation that we need as a child during that time, it could be a vulnerable time where we're progressing or not progressing in our development of our brain. So it's very important that we work with families and let them know the importance of engagement, being active, reading, doing a variety of things, as well as if they're coming to childcare or preschool or Head Start, that we're being very active with them as well. So provide early stimulation, foster strong, secure attachment, and reduce stress. The more stress that infants and toddlers are exposed to over a continued period of time, the higher the cortisol levels in the brain are. And cortisol is something that is activated when we're in a stressful situation. Okay? It pushes us to fight or flight type situation. And so if that's elevated for longer periods of time, it can cause some damage to parts of the brain. So we want to try to reduce stress as much as possible in our classrooms, but then also sharing with families, helping them understand that reducing stress is important. And the biggest one that young children see or are exposed to are abuse and neglect in infants and toddlers and early childhood as well. So there are perceptual and motor developments that are affected by challenging conditions. Okay, so genetic disorders are one, and then environmental trauma before or during birth can significantly impair physical growth. So adaptations in childcare programs and intervention programs that provide services to babies and toddlers and their families can offset these negative effects of those disorders. Okay, so just because, and this goes with just about anything, just because research shows or says that, sometimes an environmental issue, what's happening maybe at home, is causing a child to, act this way or have visual impairment or whatever it might be. Sometimes we can offset those things in a daycare setting or in our preschool setting, wherever we might be working. Not all the time, but some of those times. And so here it talks about visual impairment and some of the challenges with that. So 1 out of every 3,000 infants can have some kind of visual impairment. A lot of times this is caused because of prematurity or premature birth related to low birth weight. So visual impairment obviously can affect some of that motor development because depth perception is important in the motor development. Okay, so a child or an infant may blink often, show sensitivity to sunlight, move the head without fixing an eye gaze, basically meaning that their eyes are kind of not focused on anything. They're kind of maybe moving their head to try to track or something rather than moving their eyes. So what can we do if we have an infant or a toddler in that situation? So enlarging the motor play area. So you might have a corner of a room or a certain area in your classroom for gross motor play, like where there's a lot of movement. You might have to enlarge that. Okay, so include some auditory toys where children can hear some of the toys, hear the things that the toys do rather than just a non-auditory toy. And also identification patches, meaning that if you have a patch that the child can touch that will help identify, certain area of the room, what toys are there, then that will help the children with that. So it's kind of similar to Braille, but of course not quite the same, because a child is not necessarily blind when you're using these identification patches. And you would have to work with them to understand what this patch means. Another one that is even a little more common is hearing impairments. Okay, so 1 out of every 750 healthy infants might have some type of hearing impairment. Okay, and almost a quarter of them, or 20%, are not detected until age 18 months or later. Okay, so screening is important with that, and it's increasing in the U.S. Typically, you'll have a screening, before you get into kindergarten, in terms of a hearing and vision screening, but it's starting to become earlier and earlier, because the earlier you can catch a vision impairment, hearing impairment, any type of impairment, the better chance you have of helping the student overcome that. So common signs of hearing impairments for young children: failure to respond, whether you call their name, whether you say something, ask a question. A failure to respond would obviously be one of that. Favoring one ear or turning the head, maybe there's a hearing issue in one side and not both. Also abnormal or decreased vocalization. So if a child is not talking very much, or their speech is a little bit different than normal, could also be another sign of a hearing impairment. Okay. So what can we do? Adaptations for that. So visual and tactile clues. Okay. So, whether it be something that the child can see, whether they can put their hands on. Assistive devices, such as maybe you would be using a microphone in your classroom, okay? Which also could be acoustical. Acoustical adaptations could be something like, in our building here, we have high ceilings, right? So the higher the ceilings, the more different or loud or echoey the acoustics are. So it might be something where you have to put in like acoustic boards, right? This is kind of extreme, but that lower the kind of the height of the ceiling and absorb some of that sound from echoing all over the place. But there are different adaptations that you can use as well. And hopefully then a child could potentially maybe, if they need a hearing aid or something for a little while, that could be something that their family could look into. Okay. Other conditions then that are more genetic and not that hearing and vision are just environmental, but these are definitely genetics where play a role here. So Down syndrome, right? There's going to be some motor and cognitive delays, and also some perceptual limitations in terms of what they can and can't see. Cerebral palsy, it definitely impairs and inhibits the motor skills and physical ability of students, and potentially have the ability for loss of vision and or hearing at some point. And again, early intervention is critical in terms of working with these students to help them be able to achieve as best as they can in this situations. Okay. The last thing that they talk about, they talk a lot about across all types of early childhood stuff, is infant and toddler obesity. And so they use, or the definition of obesity is looking at body mass index. So it's not just weight, but it's this BMI that they use, and you calculate the percentage of body fat that children have, and then they compare them to other children of the same age and gender, which again can be skewed a little bit because different cultures or different parts of the world and different continents of the world adapt to climate, for example, or adapt to what types of food that they eat. So in this country more than others, obesity is linked to poverty and also to genetics, right? What we get from our mother and father. But they do talk about how breastfeeding is a very effective way to reduce the risk of obesity in children. Not always necessarily the case, but it is one way that research shows. Okay, questions?
No.
Okay.
Don't really got any.